How can healthcare leaders ensure operational efficiency without sacrificing the personalized care that is actually crucial for great patient care and outcomes?
We need both personalization, care, empathy, and we need some degree of standardization. And I think of pendulum, I know it's a cliche, but the pendulum has shifted so far away from the personalization and care and empathy that we need to bring it back in the middle.
From my perspective, standardization, personalization really go hand in hand. Standardization is sort of the baseline, sort of the background work that must happen. It's the minimum that you need, so you know what needs to be done. But then it's really the icing on top of this cake. That's like the human part, the personalization part, that any robot could do the standardization stuff, but only humans can really bring that personal touch.
So John, let's go to you. Community health. Clearly, there are community health challenges that need to be addressed through the lens of personalization. How do we do that while improving care delivery?
One, I think we have to be open to realize that our organization can't do it all alone. Second, we have to evaluate our organization's true strengths and weaknesses, and then really articulate what is our value proposition? What does our organization uniquely bring to the table? Third, we've got to start to set clear goals, have a clear vision, and have clear objectives around why should organizations come together to partner to solve a particular issue. And then fourth, we have to ask these other organizations to participate, and we've got to be clear in what are we aligning on, what are we asking them to do.
If disruptors come in and they take the slim profitable layer that exists and just leave all the non-reimbursed portions or complex portions for the providers to fix, then the equation becomes even more unbalanced than it already is. All the burden falls onto the healthcare providers.
I think there's a lot of opportunities. If data is present for a physician at the time of care that could provide them with, help them with clinical decision making. Yes, data is important. We're going to review the data, but now let's make sure that reviewing this data makes a difference in our patients' lives. Healthcare is about caring. So I think the business that we are in, that we should be in, is business of caring. And as long as we remember that, we use data, we use standardization, but we should never stop being in business of caring.